Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we start, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and our Chief Medical Officer of Health, Dr. Robert Strang. Go ahead.
Thank you, Chrissy. Before I turn over to Dr. Strang, tragically this weekend, we have another Nova Scotia family who are suffering a loss due to COVID-19. And on behalf of all Nova Scotians, I want to express to you our deepest sympathies and condolences. And I want you to know that we as a province are grieving with you and are here to provide any kind of support that we can. In the last number of weeks, there have been lots of concerns about masks. I want you to know that we've been engaged in a procurement process that has taken us around the world. Masks are a commodity from country to country and province to province. Before we could begin to distribute, we needed to be sure that we had enough, and so began our procurement journey. We've had the private sector step up, using their contacts to procure masks. Local companies not needing masks because they were not operating gave theirs over. We have relied on shipments from the National Procurement Program. We've already received 300,000 masks, and I've reached out to my friends in China, and an order is expected in the coming weeks. Currently, we have enough masks in stock, including surgical N95 and facial shields. That we are feeling confident about our supply. So this weekend we began to distribute surgical masks to frontline workers in every long-term care home, both private and public, across our province. Effective tomorrow, we will be distributing masks to all frontline workers in residential care and continuing care facilities, as well as home care workers. We are feeling confident about our current supply and that we have on order. As I said earlier, masks are in demand around the world, but we are in constant contact with our suppliers and have every reason to believe these orders will come in. I know for the frontline workers there have been a lot of anxiety around masks, and if we contributed to that anxiety, I'm sorry. I wanted to be sure that we had a handle on our procurement. That's why weeks ago, I appointed Deputy Minister to be in charge of all procurement related to COVID-19. Fred Crooks is in constant contact with the Nova Scotia Health Authority, the IWK, the federal government, and private sector, working with our intergovernmental affairs colleagues, and we are leaving no stone unturned. I'm also very proud of the local companies who are pivoting and learning to manufacture health supplies. This is a full provincial effort with government and private sector working together to protect our frontline workers who are working every day to protect Nova Scotians. Dr. Strang, I will now ask you to give us an update on COVID-19.
Thank you, Premier. So as the Premier said, sadly, Nova Scotia is reporting our third death due to COVID-19 today. The deceased is a male in his 80s with underlying health conditions and passed away in the HRM area. And like the Premier, I want to offer my deepest sympathies to the family at this time. We're also announcing 29 new cases of COVID-19 over the last 24 hours, bringing the total number of confirmed cases in Nova Scotia to 474. Currently, we have 9 individuals in hospital, 4 of them in intensive care. 101 people now have recovered and can be considered to be resolved of their COVID-19 infection. And we've had 15,580 Nova Scotians tested with negative results. We may have seen over the last week that people may be concerned that our case numbers have increased, and we tend to have about around 30 a day over the last week. But I see that as actually a sign of some good news. We are testing upwards of 800 to 1,000 people a day. The percentage of people testing positive remains about 2%. So we've expanded our testing. We're testing lots of people with symptoms that could be COVID-19, but the vast majority don't have COVID-19. They may have some other mild respiratory virus. That tells me that our process around broadening testing is working. We're looking for COVID with a low threshold for testing. We're testing lots of people, but we're getting relatively small numbers of 2% that have been testing positive. While our numbers per day have increased around 30, they don't continue to climb. That's also a sign of that gives me some encouragement. And if you look at other jurisdictions, that once they start to climb, their tests have the numbers per day have increased and increased and increased. The fact that we are now seem to be at a plateau around 30 tests a day coming in, new cases. Again, is a sign that what we're doing, the public health measures that every Nova Scotian has been asked to do, that the vast majority of Nova Scotians are complying with, combined with expansion of testing and aggressive follow-up of cases and contacts, that is having a substantive impact. It's holding us the curve at a much flatter than if we weren't doing these things. What we're doing is working. However, it's too early for us to say, well, now we can start to relax. I know that a lot of people, their Easter weekend was very different for people. A lot of Nova Scotians made extra efforts to make sure that they were social distancing, not getting together with face-to-face with family. They found creative ways to do this virtually and still enjoy Easter with their families, but keeping each other safe. I want to thank Nova Scotians for doing that. But we're not out of the woods yet. We have a few tough weeks ahead of us that we still have to be really vigilant, keep locked down, really doing everything we can do to keep each other safe. And once we do that, in a few weeks, we can perhaps be in a position where we can start to think about how do we then start to slowly relax some of these restrictions, and we can start to return slowly to life more normal as it was before COVID-19. So I see in the testing numbers we're seeing, I actually see some encouraging results. But it's too early for us to give up, to let the foot off the gas now. We have to keep the hard work, and together we'll all continue to make this difference. So I want to thank Nova Scotians again for getting through a difficult, challenging Easter weekend. And I do want to notice the Premier got an Easter haircut as well. You're looking good, Premier.
Well, thank you, Dr. Strang. I almost said thank you, Father. Thank you, Dr. Strang. I'm one of those fortunate Nova Scotians. My wife is a cosmetologist, so 30-some years of free haircuts. I happened to get one this weekend. I spent the weekend at home with her and our daughter, Colleen. It was an odd weekend, though, like it was for many of us. I had to tell our son, who is working outside, that he could not come home. Words I thought I would never have to say to him, but we had to tell him, and he understood the health protocol and understood how important it was that every Nova Scotian followed the advice of Dr. Strang, and this weekend we did, and in the meantime I was able to get a haircut. Unfortunately, the gray is still there. We'll take any questions now.
Just a reminder that each reporter will get one question and one follow-up. We'll go to Heidi with CTV first.
Thank you. I'm wondering, with the third person who has died now, what more you can tell us about where the person died, whether they were in hospital or in some kind of nursing facility. What can you say there?
So we won't go into any more details, as I've outlined before. The level of detail we give is what we feel comfortable that we're allowed to give, while still respecting the family and privacy legislation.
Areas being so-called hotspots, and I know Preston has been brought up before. What is being done to address the concerns of those who live there in terms of improving the situation?
So over the weekend, there's been a lot of hard work across government. I had a conversation with the Premier and his team on Saturday, and what's being put together is a robust response to support the public health effort and continue working with community. So even yesterday and today, as public health continues to do its work, we identify cases, we follow up on those cases. We're engaging with the community to make sure that there's good communication coming from the community as well. We know that there's long-standing challenges in certainly the North Preston community, that many families have financial challenges. challenges, housing challenges. What's being brought to bear over the weekend is establishing a robust response by the provincial government. So when we have families that have housing solutions, we have families yesterday and today that needed to get access and transportation to go to a testing site. All those things are on the ground now, so we can be very nimble in terms of supporting the necessary public health response, providing I'll call it the social supports that are required for us to wrap our arms around this community and get a handle on this disease, which is having a substantive impact in North Preston. Make no mistake, this community is very important to the Premier and I. Is a critical part of our COVID-19 response, and there's a rapid cross-government response to put things in place to support the public health effort and to support what's necessary for all the families and people in that community.
Heidi, do you have a follow-up?
I was wondering if we happen to know about how many cases have come out of incidents of public exposure. We've talked about various ones throughout the time here. There was a hockey tournament, there was a celebration of life. Do we know actually how many have come out of those specific incidents?
So we don't have in detail. I mean, we'd have to go back and track every single case, and that level of detail maybe at the local level. I don't have all that as it gets summarized and comes to me. What I do know, though, is that what we're seeing out of these public exposures, because you got to remember, we make these public announcements on top of when we do our normal follow-up. People who we know for sure have had close contact, we were already aware of them. We're already communicated with them. We're testing all those individuals. The vast majority of them are testing negative. The public announcements are more just to be safe and sure that if there are any other people in the public, whether it's at a grocery store or on a bus or at a tournament that may or may not have been exposed, that we're making sure that they're aware and what symptoms to watch for. So I can't say for sure that there haven't been specific individuals, but what I do know, and kind of the summary of the information that I get presented to me, is that that fortunately these community exposures that we're notifying the public on are not a driver of a substantive number of cases. But it's important that when we don't have another option, it's very important that we communicate to the public and that they're aware they may have been exposed. The other part is now, regardless of whether they may or the Nova Scotians may or may not have been in a situation where we're saying you could have been exposed, we're asking any Nova Scotian with a set of symptoms, so fever, new or worsening cough, headache, sore throat, runny nose. If you have two or more of those, you might have COVID. We want you to come in and get tested. Go do the online assessment first if you can, and then call 811 if you're directed. If you don't have internet access, call 811. So we think any Nova Scotian might have been exposed, so we want people with those symptoms, everybody to be tested. But as I said earlier, the vast majority of people that we're testing now, they're all negative, which to me is a sign of success of what we're doing. We're not seeing widespread of COVID-19 in general in Nova Scotia.
Next question will go to Shayna Luck with CBC.
Good afternoon. Over the weekend, the NSGEU issued a letter calling the ventilation and some of the conditions in the North Preston assessment site inadequate. They said the ventilation was a problem, that there isn't enough room for physical distancing. What plans does the province have to address these building concern issues?
So I would say that's a local. That's going to be a local level, though. Union members, if they're concerned, at the local union should be working with the Nova Scotia Health Authority, making things as safe as possible. We also have to understand there's an outbreak in that community, and that we need to bring things to bear, and we're using what's available within the North Preston Community Centre, because that's the infrastructure we have available. But there are things that can be done to make that as safe as possible. So those discussions should be happening at a local level. Not being raised to the Premier and I to try to solve those things.
Shayna, do you have a follow-up?
Yes, another for Dr. Strang, if you will. I'm wondering if you can talk about the overall aim of our strategy. Are we trying to keep COVID-19 totally contained or shut out of Nova Scotia, or sort of stamp it out of the province? Or is our goal similar to what the Prime Minister suggested last week, which more like keeping our cases to a manageable level until a vaccine is ready? Can you speak to the overall aim here?
So our overall aim is to minimize the spread of COVID-19 in Nova Scotia. We knew it was going to come here from travelers, and that's happened. And now we're getting some spread in our communities. We have a group of communities in the eastern Dartmouth area that are of particular concern, but I've just outlined in an answer of how we're rapidly addressing those communities with a more focused effort. For the rest of Nova Scotia, our aim is to minimize the spread. The purpose of that is, frankly, to save lives. We know that the fewer cases we have, the less transmission in our communities, that there's a less possibility of people with that are at highest risk for severe disease and dying from getting infected. So we know that we're not going to. We knew from the outset that we wouldn't have. That it was impossible to not have any COVID-19. That's not a goal. Our goal is to minimize the spread and protect people, minimize severe disease and deaths is our primary objective. A secondary objective is also by slowing down the transmission, we can actually deal with the COVID-19 numbers that is within the existing capacity of our healthcare system. But ultimately, this is about saving lives. I'm very blunt about this, because many Nova Scotians, even if we're infected, we're not going to get severely ill. But as I said last week, if we did nothing and let this blaze through our communities, we would have high levels of disease and hundreds of unavoidable deaths, of preventable deaths. That's not acceptable. Ultimately, this is about slowing down and spreading out the transmission, minimizing its spread in communities so we can save lives.
Next question will go to Alexa McLean with Global.
Good afternoon, Premier and Dr. Strang. I'm just wondering about long-term care facilities. Given how vulnerable that population is, why did it take until now to really go forward with widespread distribution of masks? And will it now become mandatory for long-term care workers to wear these masks and other PPE?
So masks we implemented incrementally. I think you have to understand that there's been a lot of work going on in a whole bunch of other areas, ensuring our long-term care facilities could be as safe as possible. The masks really only became an issue last week when based on some growing evidence that healthcare workers and others wearing masks decreases their risk of them transmitting the disease to coworkers and or patients or residents, and that's simply because we now have in the last couple of weeks clearer science that said some people there is certainly the possibility of people who are mildly symptomatic or asymptomatic of spreading the virus. So we are adapting our response first and foremost as with evolving science. Second of all, we had to make sure, as the Premier's outlined, that what we implemented in increasing the use of masks was done within our capacity to provide those masks. And as the Premier's outlined, there's been a tremendous amount of creative work, working with federal colleagues, working with partnerships in China, but also our local businesses to make sure now we do have the supply of PPE that we can roll out the masks based on some good science. We started late last week with our hospitals. Even though the Premier's announcing it today, the masks were being distributed throughout the weekend in long-term care facilities. And when we had long-term care facilities with outbreaks, from the very beginning, part of our outbreak measures has been making sure staff in those facilities where there's outbreaks have been using masks. So I don't think we're behind in this. It's based on science and matched up with what we now know we have a secure supply on. And as quickly as we have those answers, we've been rolling this out.
Supply has been critical, quite frankly, globally and actually in our own country, where we've seen people very quickly come out using their supply up when COVID-19 got into an institution or became more broadly spread in communities. The equipment and the masks were hard to come by. We wanted to make sure, as we were working to identify COVID-19 in our communities, trying to keep it out of our long-term care facilities, keeping it out of our hospitals, trying to make sure there wasn't community spread, we were working to secure supply, and we have that supply that we feel we can now start ensuring that we let it out. And if it actually gets deeper into any one of our institutions, we will have supply to protect our front-line healthcare workers.
Alexa, do you have a follow-up?
Yes, a quick one, thank you. Considering the chances of false negatives with testing, is it safe to allow long-term care workers to return to work without a full 2-week quarantine?
So we've been doing that in an outbreak setting. So we know that actually a false negative with this test is the risk of that is very low. A lot of people get confused and they say, well, a false negative, somebody who was tested today, let's say, for example, and was negative, and 3 days now, gets new symptoms and is tested again and then is positive. That doesn't mean the first test was negative. It just means that they didn't have COVID and then they've developed COVID. So I just want to be clear on that. When people talk about false negatives, they're often talking about that difference. But we have, clearly, we're balancing some challenges here. In an ideal situation, where staffing was not an issue and we had no challenges in making sure that we had adequate staff to provide essential care for residents, we would have all healthcare workers in a long-term care facility who were exposed off for 14 days. We don't necessarily have that challenge, have that luxury. So it's a balance. So by allowing healthcare workers to come back in what we call work isolation, it's not that you can just come back. There are very strict protocols that they monitor their temperatures twice a day, that every time they come in for a shift, they're checked. They wear masks and other personal protective equipment when they're providing care to patients. So it's a very strict protocol, but it allows us to maintain critical staffing levels. The other alternative is bringing in staff from other long-term care facilities and home care agencies. The risk on that, which I believe is a greater risk, is the more you bring in staff from another facility, they're going to go back ultimately to work in that other facility or with that home care agency. And now we've created a risk of transmitting the virus from a place where we know we have the virus into another setting. So that's more of a risk. So this is about balancing some risk. We have had lots of discussions with both our infection control and occupational health experts on this, and they're very comfortable with the strict protocols that we have in place, that there's a very low risk of allowing this work isolation to happen.
Next, we'll go to Devin Stevens with All Nova Scotia.
Hi, Dr. Strang, can you give us a few more details on the delay in releasing the projections and the modeling? Like, do you need more manpower and money to get this finished, or have you seen the numbers and they're just so bad you think the public might panic? I'm just trying to understand why provinces like New Brunswick have finished this and Nova Scotia has not.
So we're very close. It's neither of those, and certainly we're not going to hide numbers. The numbers will be the numbers, and what we will present always the truth to Nova Scotians. We're in the final process of just getting that in the right format. It's also important that this is communicated in a way that Nova Scotians that's understandable, that's not confusing, and that actually that helps Nova Scotians to understand the picture of what they're faced in our communities. Some of it is fairly complicated, so how you do the communication is really important, and then some thought needs to go into that. But we'll be coming forward very soon with some of our modeling information.
Devin, do you have a follow-up?
Yeah, just on the mask situation, how many exactly is an adequate supply? Are you talking 1 million, 5 million, 10 million? And when we say surgical masks, are those the N95 masks, which I think are the ones we want, or are they a lower tier?
No. The surgical mask is one that you would normally see a lot of people wearing in the hospital. A physician may have a mask on. The N95 or something that would be used at. Maybe here. Yeah. This is. I should have just thrown that to you.
So I'll let you speak to the overall numbers, but what we're rolling out now for all frontline healthcare workers is a surgical mask. The N95 mask is a higher level, but that's only for this type of virus, the way it's spread, droplet spread. The N95 mask is only needed in special situations, what we call aerosol generating procedures, so something where you might very temporarily aerosolize in a space around the patient particles of virus. So that would be the most common one, would be when somebody has to have a breathing tube put in their throat. But the vast majority of what we need to have, and what we're now saying all frontline healthcare workers need to use when they're providing care every day, are medical grade surgical masks.
And those surgical masks we will require millions of them, and we continue to have some that take us to the end of April, early part of May. Our orders that are coming in now will take us into June, and very encouraged by the potential of having a Nova Scotia manufacturer up and running soon.
Next, we'll go to the Canadian Press, Michael Tutton.
Dr. Strang, there's been a sudden doubling in the infection rate at Northwood, Atlantic Canada's largest nursing home. I think we're up to 16 infected patients. To what extent are you worried that we're headed down the path of Quebec, where nursing home COVID positives may start to overwhelm staff?
So certainly the situation at Northwood, like any long-term care facility, is concerning. I do know that all the necessary steps that we can take to minimize the spread and have an outbreak under control are taking place at Northwood. It is a challenge, though, when you have an infectious disease like this and you have vulnerable residents, and it is very troubling and concerning. I do have lots of confidence in Northwood as an organization. I personally know the executive director of Northwood, who I've worked with for 20 years here in Nova Scotia. She has a ton of expertise in infection control and managing outbreaks in the long-term care setting. So while I'm concerned about the residents, I am very comfortable that everything that could possibly be done within Northwood is being done.
Michael, do you have a follow-up?
Premier, the unions that represent workers in nursing homes say that the COVID crisis is revealing a deep underlying problem of staff shortages that should have been remedied years ago, and it'll continue to reveal that. What's your view of that not post-COVID, but sometime in the future, whenever that may be? Does this cause you to reflect and think that the time has come to change those staffing levels in Nova Scotia?
Listen, I first of all want to thank all those Nova Scotians who continue to care for our loved ones in long-term care facilities across the province, whether they're in public or private institutions. We've continued to work with them. We've continued to provide support for them. This is not, quite frankly, a time for anyone to begin to negotiation contracts or staffing models. This is about a time of Nova Scotians coming together to ensuring that we provide this frontline workers with the support they need, and wrapping our arms around each other and in this community. There'll be lots of times for debate, and unions and others will have their opportunity to criticize or question what we have done or what has been done in the past. I want to make this very clear to all Nova Scotians. My focus is about ensuring that we save lives, we follow the advice of public health institutions, and that we support not only our frontline care workers in hospitals, but those in long-term care facilities from one end of this province to the other. And this gives me an opportunity again to say thank you. I know this is challenging for you and your families when you get up and go to work every day, worried about the people you work with. I know you're worried about whether or not you may have the symptoms taken into the facility, or quite frankly, you may contract it in the facility. We are providing you with the support to ensure that neither of that happens to the best of our abilities, and we will be there to help support you and your families, just as you are there to help support our families in our time of need.
Next question will go to Nicole Monroe with the Chronicle Herald.
Thank you. So I know that the lab in Halifax is operating 24/7, but as announced today, Health Canada approved Spartan Biosciences rapid testing. So is Nova Scotia in consideration or in talks with the company to have that testing here in the province?
So that was only announced yesterday. I've already had a conversation with Dr. Hatchett, the director of the microbiology lab. We certainly will take an urgent look at this new testing device and what role it could play in our testing strategy.
Nicole, do you have a follow-up?
I do. This is a separate question. I know that construction has been deemed an essential service in the province. However, a few people are concerned, workers or people that have construction workers coming into their building or nearby. So can you just explain why construction in terms of projects like apartment buildings being built is an essential service and why that isn't a possible thing to be put off for 2 months?
Well, as part of when we were looking at about the issues of how do we follow public health orders, we looked at construction sites where the 6 foot 2 meter distance protocol could easily be followed. I was actually on my way near today, noticed some work that was happening on the 101 construction site near Windsor where everyone was either in equipment or well past 6 feet apart. The same thing can happen in apartment buildings where we're actually can have people on different floors. We also have to have some economic activity going on in our province. We can't completely go to a complete standstill where we've seen issues that we felt with the advice of Dr. Strang that there was a workplace that couldn't operate or didn't have the appropriate protocols in place and protection, we would close it. That's why the service industry, we aggressively moved on very early on. We were one of the first provinces in Canada to ensure that the service side of our economy was closed. And then we moved to the other aspects of our economy. Is there a way to have parts of it operate? And we felt that was the case. I can tell you we have inspectors on work sites where there are issues. People are being identified and our inspectors are enforcing what is our regulation, and we'll continue to monitor that. But as we deal with COVID-19 and we continue to have progress on trying to control it within inside of our province, we need to also make sure that our economy is somewhat in somewhat of a position to allow us to come out of this whenever public health orders are lifted.
I can just add that. So I've worked with the Occupational Health and Safety Division in the Department of Labor and Advanced Education, and they have been working, and they have asked the Construction Association of Nova Scotia to produce comprehensive protocols how a construction site would be able to continue to operate while, as much as possible, maintaining the directives around social distancing, supporting hand washing, etc., knowing that there may be some circumstances on a construction site where you can't maintain the social distancing. So I've reviewed those protocols with the Occupational Health and Safety Division. So I guess, in short, the answer is there's been a lot of input from government, from a public health perspective, from an occupational health and safety perspective, to the construction industry. And as the Premier said, there's ongoing inspection and compliance, as we do with all industries that remain open. There's a strong focus on occupational health and safety, and I give my input on a range of issues related to existing businesses to make sure they have good protocols to follow public health advice and recommendations while they remain open.
Next question will go to Evan Taylor at CKBW.
I was wondering, as far as the investigations go, when you have confirmed a case and trying to find who they may have come into contact, could you just go into a little bit of detail about what the process of those investigations look like? What tools do you use? What questions do you ask? Those sorts of things.
Well, it's the process is actually quite straightforward. We get notified of electronically when there's a positive case from the lab. As soon as possible, when we get that positive case, and we have public health staff working 7 days a week from morning till 10 o'clock at night doing this work. We make contact with that case, and we interview them. It's very like detective work. We start to understand when did they become sick. and then we go because of the potential for them being infectious, and we go start with 48 hours before they started to become ill, and then we work with them to understand where were they, who they were in contact with, and then we follow up with any contacts they identify. If they identify a workplace or a business or some kind of a group setting, we've had some grocery stores and other things, we then work with those settings. And as I've said earlier today, into another question, sometimes we need the public notification. But it's very much interviewing, talking to people, going through a very detailed history about where they may have been and who they would have been in contact with. Fortunately, still in many of our cases, that we have people who we're already aware of because they were already identified as a contact of a case, and we put them on self-isolation, and we then monitor their symptoms, and we test them early on, and if they're negative early on and then they develop symptoms later on in that 14-day period, we test them again. And if they test positive, by and large, most of those people that we're aware of, because they've been put on isolation right away, they have had little to no contact with anybody else, which is exactly what the circumstance we want to have. Some of our other cases are travelers who have been on the self-isolation, and then the same thing. They've had little contact with other people. But now we have a growing number of cases, especially in the HRM area, where they have been working or out and about in the community, and then that makes the work harder. We have a lot more people that we need to track down. But it's very much using the telephone, talking to people, doing very detailed interviews, and then doing the follow-up on all the people and the settings that were identified through that initial interview with the case.
Evan, do you have a follow-up?
Yeah, I do. In saying that it's like police investigation, police have the ability to look at phone records and where people have been in geotagging. Has that been discussed or used at this point, tracking people's phones and seeing who they may have come in contact with?
So there are discussions on using those kind of technology at a national level. There's certainly an apps and tracking things, people's movements. There are a lot of privacy concerns around that. So I think Alberta is leading the way in this kind of technology, but we're certainly involved in some conversations at a national level. Some of my colleagues in the Department of Health and Wellness on the kind of technology side are involved in those conversations as well. But today we're not using them. Again, there's a number of privacy issues that would have to be resolved, but we are actively looking at that.
That's all the time that we have today for questions. Go ahead, Premier.
Thanks very much. Dr. Strang has gone through the numbers of tests that we've completed over this weekend, and we are doubling down again this week. The more we test, the more COVID we find, and that is a good thing. It protects us all. I want to thank all the lab staff who've literally been working around the clock to process our tests, which allows public health to run close to 1,000 tests a day. I want to thank all of our frontline emergency service providers, police, fire, ambulance, and those at 911 call-taking center who operate 24/7 to ensure emergencies are answered. We want to thank those who are working the phone lines to help those who are in distress. Your voice on that end of the line is a comfort to people who need that comfort in uncertain times. And I am grateful that you are on the other end of the line. To those who are processing applications for government programs that are providing much needed financial work, this may seem tedious work to you at times, but it is so important. It is helping families keep a roof over their head and food in their fridge. And there's a group of frontline workers out there providing essential service that we might take for granted, and we shouldn't. To our cashiers in grocery stores and in our pharmacies, and to those who work at soup kitchens, food banks, and the social workers that are trying to help our families in need and that are homeless, thank you. And I want to express not only mine, but Nova Scotia's deepest gratitude to you and to your family. Your work is so important. You matter, and we need you. We are now 5 weeks in, and we are not out of the woods. We have to continue to follow public health protocols. We need to dig deep. We need to stay strong, and we need to continue to love and support one another. And when we get a chance, say thank you to a frontline worker. Do it virtually, or steal an idea from other jurisdictions and stand on your doorstep and balcony and bang a pot or pan And in my neighborhood, they've left on their Christmas lights now for the last number of weeks to express that. Not only will you being able to do that make you feel good, it might also allow you to blow off a bit of steam of being isolated following Dr. Strang's orders of making sure that you stay home. But it is important that you do.